Hey Jess, I just want to talk to you before you headed out. Let you know I was kind of watching you interact today, and I wanted to give you some feedback. And I know we had talked earlier about how you'd been wanting some more feedback on how you were doing, how you were progressing. So I thought if you had a second, we'd just go ahead and talk about a couple of things I saw going on today. So something I saw that I really liked, and I think you've been doing a really good job, and correct me if you think I'm wrong, but I feel like you've done a really good job of connecting with our patients and building a rapport and a trust with them. While you were working with Beth today, I really saw that. I saw that you've been able to build some trust and a relationship with her. And as we've mentioned before, that's really important. So I think you're doing a great job with that. One thing I did notice, and I haven't had a chance to address this with you before, but I kind of wanted to address it now. I know when it's a little slower in here, sometimes we get on our phones and we find that escape. But when we're working with patients, we really don't want to be getting on our phone. You're giving Beth a few seconds to relax and kind of get out of the mindset. And while you were playing on the phone, it gave her a chance to get distracted as well. And along with that, she was even able to distract Zach over in the corner doing his rehab too, and got him off track. So we want to make sure that we uh, aren't doing that, and that we have a no phone policy for our patients and for our athletes. And it's hard for us to hold them to that when we're on the phone and we're kind of allowing that to happen. So I think moving on, we need to be really conscious about when we're getting on our phone. I saw that you did some objective measurements with her, or you at least had her go through some range of motion. And I know that's something we had talked about before, was looking at some objective readings. And I think you did a really good job looking at those. But let's remember that just looking at it isn't going to give us a lot of really useful information, and it doesn't do a lot as far as our documentation too. And I know documentation is something we've talked about improving on. So it's not any harder to grab a goniometer, and you can use that. It's just as quick, but it gives us a good measurement, not only for us to document, but I think for Beth too. You may have noticed that she was asking how things looked, and you could tell she was really wanting to hear how she's progressing. And for the most part, you do a great job of giving that back to her and giving her some answers. But I think giving her something a little more objective that she'll be able to see too will really help her buy in that these treatments are working. Uh, and then there was just one more thing that I noticed. When you were doing some single leg balance exercises, you had told her to stand on her bad knee. And this is something that we really want to try and avoid. I know I've talked to you before, and I understand it's a really hard habit. Every student I've worked with has gotten into the habit, and that's even been something that I've had to work to break. But we really don't want to describe our patients' injured body parts as a good arm, a bad arm, or a good leg, a bad leg, because that's really going to reinforce this stereotype that right leg is any less than the left leg. And sometimes when we do that, we really create a sense that in our patient's eyes, this will always be my bad leg, or I'll always have a bad back. And we really don't want to do that for the well-being of their entire quality of life. So moving forward, let's try and really focus on referring to it as the right leg or the left leg, and not letting the patient have that excuse of, this is my bad leg, this will always be my bad leg. Because there really is no bad leg. There's an injured leg, and then there's a non-injured leg. But I think the easiest way we can respond is right and left. Other than that, like I said, you've been doing really well with your rapport with your students. I think we talked about a couple things you can work on, right? The documentation, our vocabulary, and the way we're interacting with patients, and then making sure we're not using our phones, especially when patients are around. But other than that, I've been really happy with the progress you're making. And I think if we continue down this road and you continue to take my advice, you're going to have a really, really great year of growth in this profession.